Welcome to a new episode of our weekly series COVID-19 Science in Context. This week, the UK reached over 4,270,000 confirmed cases and 25.2 million adults have now received the first dose of their vaccine. I'm Sabine, and joining me today is Prof Azra Ghani, whose team works closely with the World Health Organization, Gavi and other global health partners to inform the rollout of the vaccination programs. Azra, what will it take to vaccinate the world?
Well, of course, rollout is going very well in some countries, but two of the biggest issues are both supply of the vaccines, but also then uptake in populations. The UK at the moment, we've got a very strong supply and uptake has also been very promising. And so we're seeing this rapid rollout in vaccines. But of course, in many parts of the world, there's a much more constrained supply, and that's partly due to the fact that they are relying on donations, for example, from the COVAX facility. And it's very encouraging to see the vaccines are being rolled out through this facility now to the lower income and middle income countries.
So currently the AstraZeneca vaccine is being pulled or paused in several countries, and with future vaccine supply being constrained, how do we prioritize the distribution of next batches that become available?
First thing to say is, of course, what has happened this week with AstraZeneca is a standard thing that happens in all clinical trials. There is a post-marketing process where surveillance is in place to pick up any very rare side effects that could be attributed to the vaccine. We don't have conclusive evidence yet of what this is, but what we're seeing is what is often reported, but perhaps not so publicly, for previous vaccines. Of course, supply is really a big constraint, both in the UK and across Europe, and as we're seeing, rollout is going at different speeds. We don't want to be relying on one single vaccine, and there are many that have been developed and we've been very successful in terms of the trials, and the availability of vaccines will determine both the speed with which people can be protected, but also the speed with which social restrictions can be lifted. We need to make sure that the whole world is protected, because as we're seeing, these variants are emerging in different countries, and where there is ongoing transmission, that is most likely.
Thank you so much for your time.
Thank you.